What's up everyone, I'm Dr. Chiddy and I'm here with the Cosmetic Lane. We're going to be answering some of your questions today. Hi, I'm Chidester, some call me Dr. Chiddy. I'm a board certified plastic surgeon and I'm in Salt Lake City, Utah. I've been in practice for 5 years and my practice specializes in Mommy Makeovers, which I call Mommy Takeovers. A little bit about me, I was actually born in Chicago, grew up overseas in Saudi Arabia, and then came back to Utah. Met my high school sweetheart here in Salt Lake City. We ended up doing our undergraduate and medical school training here at the University of Utah, and then we moved to Southern California in Loma Linda, where I trained for plastic surgery for 6 years. So a lot of people ask me, what's this Mommy Takeover? Some people call it a Mommy Makeover. I personally have called it a Mommy Takeover. Mommy Takeover really is a surgery that's helping a woman get back her body or take control of her body once again after having kids. It's a really powerful set of surgeries, and it's not just one surgery typically, but it's a customized set of surgeries. So that a lot of times includes breast augmentation, whether that's tightening the breast, removing some loose skin, and adding volume through implants or fat. That's one way to help restore breast youthfulness. The tummy, a lot of people have heard of a tummy tuck. That's removing loose hanging skin after having kids and repairing the muscles. And honestly, there's so many functional benefits from a tummy tuck. A lot of women say that their back pain resolves. I've had women tell me that their reflux has improved, that their irritable bowel or their constipation problems have gone away. Stress incontinence, or like just jumping or sneezing and peeing, that goes away, gets better. Pelvic floor pain gets better. And even sex and intercourse is much more pleasurable for women. So my personal recommendation as a plastic surgeon to women who have had children or now considering a mommy takeover or any elective cosmetic procedure with their breast or their tummy, usually I recommend a time frame of at least 6 months after you're done breastfeeding. And that's because you really want your breast volume to kind of return to what it was before having had kids and breastfeeding as much as possible, and really minimizing the amount of milk production that's present. Because if we're going to be doing an implant or breast lift, we want to avoid as much as possible having any contamination from any milk that might have bacteria. And then same with the tummy tuck. If you're not planning on breastfeeding and you'd like to have a tummy tuck, I usually recommend at least 6 months after having your last child. That's actually one of the most common questions I get when it relates to breast augmentation, specifically with implant placement, is are my nipples going to change in terms of sensation? Are they going to become more sensitive or numb or anything in between? That can vary really by what size of implant you're having done. And I advise women that the larger implant you do, and maybe the more projected implant, the more likely it is to potentially have nerve changes, maybe even some numbness. And that's mainly because the nerve to the nipple comes from underneath the nipple. It doesn't come from the size on the skin. So when we're putting a large implant under the muscle or in the breast tissue, that's actually stretching out the nerve that travels to the nipple. And the more it stretches, the more potential it has to have sensory changes. And that's not in everyone, and majority of women do not have sensory changes. If they do, they're temporary. I'm gonna be straight honest with you, and I tell this to my surgeon colleagues, I don't do the same thing twice. Meaning every patient, every belly button's different, right? No one has the same belly button baseline. So I don't try to create a belly button that is just a cookie cutter belly button. So I think that's the first thing, is trying to look at a patient's anatomy and trying to match their new belly button with what they had before. I actually spend a lot of time on the belly button. I spend, if a tummy tuck takes 90 minutes, I spend about 25 minutes on the belly button, because to me in the end that's the most important thing, and that's what people are going to see. So really, as a plastic surgeon, it's discussing with my patients, how can we hide your scar, make it as thin as possible, but still get you the final result you want. And so, for me, the scar, first off, starts at placement of the scar. And everyone's going to be different, and every surgeon places them in a different location on the person's body. After surgery, the parts that we can control are not how you make your scar, but how we augment that and help that scar calm down. So we have a lot of scar care regimens, whether that's topical creams, whether that's injections of certain types of steroids, whether that's microneedling or lasering or pigment reducers. There's a lot of things we can do after surgery to help minimize the scar. Any skin tone can have keloid scarring or hypertrophic scarring, we call it. And so one thing that we notice in a lot of these types of scars is tension, right? So the more tension or irritation there is to an area of skin, the more likely a person is to have potentially keloid or good option in some patients, I think. I don't do it very often because I feel like the scar that goes across the entire upper chest is sometimes a little bit too much for a lot of patients. But there are some women who have had breast lift surgery and they already have a pretty wide scar underneath their breasts. And they also have loose skin above their belly button that may not be really addressed by a full tummy tuck from pulling down below. So a reverse tummy tuck would be to pull that skin upwards, up towards the base of the breast and removing a strip of skin. And I think there are some patients that are good candidates. But again, it comes back to setting expectations with patients. If you're not comfortable with having a visible scar that comes across the top of your chest, then it's probably not the best option for you. It's always on my mind as I'm interviewing patients in a consultation, if one, their expectations are reasonable. So this is a lot of things that we tease out. I shouldn't say tease out, but address during a consultation. It's present, it's out there, but really, if the expectations don't meet a reality, in my mind, you're just not a good candidate for surgery at this time. And so patients who maybe have a surgery and then are unhappy with the results, again, that comes back to maybe their expectations weren't a reality. And so to me as a plastic surgeon, that's the hardest thing to do, is really to meet expectations of patients and just understand what they want. But once we get that and form that patient, doctor-patient bond, we have that same goal, we get really good results in patients. The Sony Bra is something that myself and my wife Mindy and our office manager Sammy came up with. I don't wear bras, so I am not the expert in this, but as a plastic surgeon, I saw there were a lot of issues with post-operative care, like bras in general, and I tried several different brands. And for women, especially getting augmentations, it was really hard to find a bra that can really adjust and customize to their frame and their cup size. Sony Bra is a bra that's very customizable, so this is one of them. It has several clasps on the front, so there's several rows so you can adjust the band. The strap over can be crossed in the back like a racer back or just normal straps. There's even along the sides that you can even customize more in terms of tightness. And then it's padded in the areas that you need padding after surgery. A lot of people hear the term cosmetic surgeon, aesthetic surgeon, plastic surgeon, and what's the difference? And really, when it comes down to it, cosmetic surgery and aesthetic surgery, it's the same thing, but really cosmetic surgery is a small facet or aspect of plastic surgery. So I'm a board certified plastic surgeon, and one area of plastic surgery that we train in and specialize in is aesthetic surgery. So what does aesthetic mean? It means it's addressing the overall appearance or symmetry of a patient. And all these principles of aesthetic surgery or cosmetic surgery come from reconstruction that we learn in plastic surgery. So all these tools that we get as plastic surgeons are the same tools we use to reconstruct as we do to perform aesthetic surgery. And so my recommendation always is, if you're looking into a surgeon, you want to know if they're a board certified plastic surgeon by the American Board of Plastic Surgery like myself, or a cosmetic surgeon who's from another board that's not recognized by the ABMS. You can go to abplasticsurgery.org, or you can go to plasticsurgery.org, and you can type in your surgeon's name and it'll tell you if they're a board certified plastic surgeon versus another specialist cosmetic surgeon. So for someone coming into the industry of plastic surgery, whether you're a plastic surgeon, a provider, a nurse injector, or anyone in the healthcare aesthetic industry, breaking into this whole industry is like, what do I do, right? Like, how do I fit in? I think really it's finding your own voice first off, right? You already have the proper training, or you're looking at getting the additional training to do your job, but really it's being yourself and connecting with your patients. That's, to me, the most important thing at the end of the day. Life's about making those connections with other human beings and finding those meaningful interactions. And so if you're gonna do that through a career in aesthetics, I think it's trying to find your own voice. And that can take some time. For me, it took a few years to really hone in on who I was and who I wanted to be and what I wanted to put out there in public. And at first I didn't want to dance, but you know what? Life to me is short, and being able to express myself through dance, that's how I do it. And whatever your way of expression is, I would go for it and just be yourself. And you're going to attract those people to you who are drawn to your personality. You're not going to attract everyone, but you're going to attract plenty of people. Because guess what? There's other people that are just like you. Yeah, definitely a hot topic right now is artificial intelligence or AI. How does that play into plastic surgery? For me, AI, I love technology, and I love, being innovative and thinking at the forefront of how can these things be applicable to AI and in plastic surgery. I definitely think there's a component for it. Now, is AI and robotics going to take over plastic surgery? Probably not in my career, at least, but there are a lot of aspects of plastic surgery, whether it's analyzing data, whether it's reviewing images from mammography, breast scan, whether it's looking at proportions and measurements. A lot of these things can be done, calculated, and really diagnosis is given through AI that may be better than what the human eye can see or detect. So I think, although I don't think it'll take over the plastic surgery industry anytime soon, I do think AI will become a very integral component to what we do as providers to really give the best results and the best care possible for our patients. So just thinking back to the first time I connected with Harmony and Justin at the Cosmetic Lane, it reminds me of a kind of a dark time in all of our lives. It was during COVID when Clubhouse first came out and we're trapped at home. I wasn't doing surgery at the time. I was taking call at the hospital for emergencies for hand patients, but I wasn't doing cosmetic surgery. And so I had time with one of my colleagues, Kardashians. He had set me up on Clubhouse, and I would do these Clubhouse live events, and we would just talk about plastic surgery, we talk about COVID, all these things, and that's how I met them at the Cosmetic Lane. And it was really fun to make that bond at that time, because I think the goals they had in mind in terms of helping the general public understand more about plastic surgery, and the goals I had on Clubhouse as well to try and educate people while we had nothing else to do, I think it was cool because we kind of meshed together and created this bond that we've now had for several years, which is super fun. I don't know that in particular, but a lot of the techniques that I use in terms of breast surgery, I do a lot of breast surgery, and I do a lot of revision breast surgery from complicated cases. So women who have had 5, 6, even 7 breast augmentations before, done a lot of revisions to help kind of give them the look they want. And I think the tools that I have to do that may be a little bit different than some other surgeons in terms of how they implement them. So there's like the Kardashians. I think they are beautiful women, all of them. I love watching their show on Hulu, but I would love to work with the Kardashians, at some point. And they say they don't have implants, but I would love if they ever need to exchange their implants. I'm here for them, give them the internal support, give them that longevity, if that's something they need. So my top 3 shoes in the OR, I'm a huge Air Jordan fan. I got my Spider-Mans on today, but I'll be honest, the Air Jordans are the worst to wear in surgery because I'm standing all day, 10 to 12 hours, they're just not comfortable to stand in. So my top 3 shoes, and I hate to admit this, but this is how it is. Number 1 are Hokas. The Hokas that you get on Amazon, whatever, they're actually super comfortable to stand all day. I used to have really bad plantar fasciitis, and in the Hokas, it's completely gone. I actually wore Air Jordans for the first 3 years until I literally blew out the sole because I was standing in them all day, and I had really bad feet pain. So that's gone. Number 2, don't tell anybody, I have a pair of Crocs, and Crocs are incredibly comfortable to stand in. I only have worn them in surgery. I don't have the ones with the holes in them because you don't want any fluid getting on your socks. But those are probably the second most comfortable pair. And then number 3, I used to wear Danskos a long time ago because they have really thick soles. I'll be honest, depending on the arch of your foot, that can compress my nerve, and I got really feet pain. So as much as Danskos are really popular to stand in, I don't love them, but they'll probably be number 2. All the OffWhite shoes, like the Air Jordan 1 OffWhites. Yeah, my wife and I, we're a really good team together, and we've known each other since high school. So we've kind of gone through the whole thing. We've grown up together, we've matured together in a lot of ways, but we've kind of come together now as business partners, aside from us being husband and wife. And it's hard. It's really hard to balance, I think, personal life, your romantic life, and your business life, right? And so trying to get that together, it's this interplay. It's like a dance almost. But I think we've come to a really good spot in our relationship and in our business relationship of trying to separate out, okay, when we're home and with the kids, that's family time, and with the tendencies over dinner to talk about business, because we could just talk about it all day, because she runs the office, she runs the spa, I do the surgery, and so there's always time to talk about it. But really, I think separating it out and dedicating our time to our kids or our church or our friends, and then there's a lot of other time where we're doing business meetings and we're doing that all the time. But I think that's the most important thing, is just really kind of trying to compartmentalize our lives. Otherwise, it's just too much.